Hi, my name's Logan. I'm a student physical therapist assistant at Owens Community College, and I'll be working with you and Lucy today. Now, before we get started, can I have you verify your name and date of birth for me? Awesome. And then Lucy's as well. Thank you. Now, it looks like we're in today because Lucy's showing a little delay on her milestones. And that's okay, that's why we're here today. So we're gonna be working through these, and I'm gonna give you some exercises and explain what some of these means, because I know doctors can just throw things out and it sounds a little scary, but I'm gonna try to make everything make sense for you so we can get the best help at home and in the clinic here for Lucy as well. So today we're just gonna go through what the deficits mean, what the exercises are, how they're gonna help her, how to do them at home, and how many times we should do them at home, when to stop, and then we're gonna give you a home exercise plan, and that's gonna be sent to you in a PDF, and then you can have all the access to that, and then I'll give you information on who to call, if you had any questions or any concerns at all. And then that sums up what we're gonna be going through today. So I am gonna be using this cute little sloth as my mock Lucy, since this is over video. So the very first thing that we're gonna be doing is going over a deficit, and the first deficit that I noticed on Lucy's chart was that she is unable to pivot on her tummy. So this is just gonna be when she's laying on her belly, reaching for toys, she has a little bit trouble weight shifting. And this is super important for when she's trying to roll over or start sitting up. She is gonna really need that trunk stability. So this is something that we're gonna work on. And this is gonna help strengthen Lucy's back and develop coordination, since that's super important for playing and just being able to be independent. So the second deficit that I noticed was that she's unable to roll over. And this is also developed in 6 months. So she's not too far behind, but we're slightly concerned about this. So we are gonna make an HEP for this and really focus on this, because it's a very fundamental movement in everyday life, from laying down to sitting to standing. It's all like trunk stability, and we're just really gonna focus on this. All right, and then the third deficit that I noticed was that she prefers to sit in W sitting. W sitting is just your legs are out like this, and then you're seated like this, and this really takes away the core stability that you need and puts it all on your knees, your hips, and it's just really bad for your joints, and then it makes it a passive sitting motion as well. We really want Lucy to be independent, so we're going to be working on her trunk stability with some exercises and just stability and sitting as well. So now that we went through the deficits, I'm going to go through the exercises in the same order of the deficits that we listed and talked about. So the first intervention, this is going to be to help strengthen her back muscles and her shoulder girdle, and it's really going to help with like head control as well. So this is gonna deal with you sitting up with good posture as well. So I want you either against a wall or a couch or just anything with a stable back surface, and you're gonna sit with your legs straight out like this. They can be slightly apart, and then you're gonna lay Lucy across your legs, and then you're gonna have her hands straight out in front. So I'll show you a side view as well. I'll pretend like there's a wall behind me. So you're gonna have Lucy laying across your legs, her hands flat out in front of her. So Lucy's gonna be just like that. I'm gonna have you place your hand right in front or right on her back, and this is gonna help with trunk stability as well. So she's gonna be reaching to the ground. You can have a pretty picture, like a toy or something that she likes to look at, a little out in front. So her head is slightly extended and looking forward, and then her hands are flat on the ground. You can put toys out so she can start reaching for them, and then your hands back here to help facilitate some weight shift and really control where she's going. So I don't want her butt right up in the air. I want her nice and flat, her back neutral. And then her, like I said, her head slightly extended and then looking forward. Hands straight down, and they should be straight. They shouldn't be bent. And then once she gets a little more control, you can move your hand down to her bottom or even down to her legs. And then just really encourage her to have a good time with this and reach for her toys. And then if she's uncomfortable or if she's getting tired of this, go ahead and stop. We don't want to drill this into her too much. Just do this as much as she can tolerate. Lay down. All right, so the next intervention that we're going to be going through, so if she is, if her head's down, this is going to be bad form. We really don't want that. So if that's the case, I want you to help keep her neck up, and then we can just help her weight shift just so she can get that motion as well. So and we're going to do 3 reps of that. So hands down, face extended, and then looking forward, and then we're going to help weight shift. So she's reaching for a toy. All right, and then we're going to do that one more time. Yep, just like that. So really make sure your hand's on that back to help her do that weight shift. All right, and the next intervention that we're going to be doing, this is also the HEP that we're going to go through at the end. So this is to help with her rolling, and I'm actually going to get to this side with this. So you're going to be sitting on the ground. Lucy's going to be face up, and what we're going to do, I want you to place one hand behind Lucy's back, kind of like under her armpit, and then grab her whatever leg. So I have her right leg right now, and we're just going to put it over her other leg and reach, and I want her looking forward, or not looking forward, looking to the way that she's rolling. So once you put her leg over her other leg, we're gonna complete that rolling. And then once she is done with going from her back to her belly, we're gonna help her roll over to her belly and do the same motion. So we're gonna do that one more time. I want you to make sure that you're having good posture as well, just to, we don't want you to be straining your back or anything. So I want you to have your back nice and straight and your neck in a neutral position, slightly leaning forward, engaging your core. And so we're gonna throw her right leg over her left and make sure she's looking the way that she's rolling. I don't want her looking away. We don't want to strain any neck muscles. A way to encourage her to look the way that she's rolling is to put a toy or a pretty picture, if she likes fans, put it over there so that she can really be encouraged to roll that way. So this is a very important motion for all transitional movements. So like I said earlier, from laying down to a seated position, babies like to roll. This is just really going to help with trunk stability, coordination, and anything that she needs to play and just to do the things that babies do. All right. And so we'll go over the HEP at the end, and then the very last exercise that we are going to be doing is to really help her sitting stability. Just because she is known to be sitting in a W stance, which like I said, it's just like this. We really don't want to see her sitting like this. It's bad for her joints, bad for her trunk stability, which we need that throughout her entire life to do so many things. So it's super important to really discourage her from sitting like that. So what we're going to be doing, I'm going to have you, just like the first exercise, sit with your back supported. Place Lucy in between your legs, like so. And I want you to place her legs under one leg, just so you can help anchor her legs. And if you see her wanting to go in a W stance, then you can just recorrect her. And this might just be enough for her just to really get used to sitting like this. And once like she's comfortable in this position, you can place toys out her for her to reach. And this is really going to challenge her trunk muscles. And so just put toys out, reach. You can place your hand behind her back to help encourage her or help her reach. And as she gets better, take your hand away, and your leg will be here in case she falls over. But it does say in her chart that she doesn't have the reflex to reach. So if you notice that she's losing her balance, take her hands and put them on the ground, just so she can start to learn that she can catch herself when she falls, okay? And then if she is stable enough, try to take your leg away. Spread your legs a little bit. You are here for support if she needs it, and then start having her reach out. And then you're here for support to guide her. It's okay if she's a little wobbly. That's going to be testing her trunk muscles as well. We want her legs out in front. We don't want her looking up. We want her looking forward towards the toys. And then your posture is important as well. And all right, we're gonna do this 3 times. So first we're gonna start here, and she's gonna reach for her toys. Awesome. Then one more time. Perfect. Another time. Awesome. Kind of like the other exercises, I'm not gonna give you any reps or sets, maybe 2 minutes, but let's just do this as much as she can tolerate, or whenever you guys are playing and you feel comfortable doing it. At least 3 times a day. But we don't want to overdo it, but we really want to make sure that we're doing these exercises to really help her develop these milestones. All right, so now I'm going to pull up the HEP, and I did send you this over our email. So go ahead and pull this up. I'm going to go through it. It looks just like this. I listed the intervention, step by step, when to stop, who to call, and I drew some very poorly pictures that I labeled. So if you have any questions over those, just let me know and I will explain. So this is to help facilitate her rolling. This is exactly like the exercise that I showed you earlier. So I'll get back in that position and show you. All right, so this is to help stimulate rolling, and this is very important just for transitional movements and day-to-day life and her playing. So we really want to encourage doing this at home. Like I said, 2 minutes, up to 3 times a day, or as many times as you can squeeze it in. I know life gets busy, so just as much as you can when you can. So we're gonna have Lucy laying on her back. Your hand's gonna be behind her back, and we're just gonna put her right leg over her left leg. Make sure she's looking to the left side since she's rolling to the left, and then help her roll to her belly. All right. And then once she did that and you helped her a lot, maybe just progress to only flipping her right leg over her left. And then once she progresses with that and she seems to be getting it, you can just touch her back and maybe she'll roll from that or need a little more help. But we really want to progress. We don't want to be helping her the whole time. You want her to be start moving and using those trunk muscles and everything. So help her, but don't help her too much, because that's not going to help her. We really want to activate those core muscles and stimulate the coordination and her back muscles to really help her roll over. All right, so we're going to do that one more time. If she is showing any signs of pain or discomfort, I want you to stop immediately, and then maybe come back to it a little later. Babies get fussy, and that's no surprise. It's fine, but just come back to it and make sure you get a few reps in each day. And then if you have any questions, you can call your pediatrician or the physical therapist, or you do have my email. So if you have any questions, just email me. I know this can be a scary time, but we're all here to help Lucy, and that we want the best for her. So at any time, whatever question, no question is too silly, please send it my way. Thank you for trusting us to help Lucy. I really appreciate you listening to me, and I can't wait to see the progressions that Lucy makes, and thank you so much. Have a good day.